I'm Jamie Kondis, and I'm here to talk to you about the difference between spitting up and vomiting and when to be concerned. First, spitting up is something that all babies will do at some point. Spitting up is a relaxed movement of formula out of the mouth, often associated with burping. It may happen because the baby has been overfed, or it may happen because they've gulped in too much air and they need to be burped more frequently. It may happen because they have a condition called gastrointestinal reflux. It may happen because they have too much stimulation right after eating. Spitting up shouldn't be causing them any type of distress. In contrast, vomiting is when you have a forceful contraction of your muscles and your diaphragm stimulated by the brain because of different things. It might be caused by a virus, like the stomach virus. It might be caused by a drug or a chemical that the child has ingested. Or it might be caused by a reaction to a noxious smell or sight that the child has just experienced, or it might be caused by an inner ear reaction like in motion sickness. Vomiting is much more forceful and causes the child some pain and distress. So when do you want to be concerned about spitting up? If the spitting up suddenly becomes more forceful, like projectile vomiting, that might be a time to call your doctor because it may indicate that your infant has a condition called pyloric stenosis, which is when you have kind of a blockage in your stomach which can cause some really forceful projectile vomiting. You also want to be concerned if the spitting up changes and becomes more forceful and is associated with other symptoms, or if it's associated with something like fever or diarrhea, where it may be associated with an actual infectious disease. Or if you suddenly have a different color to the vomit, like a bright green color. The good news is that all babies outgrow this, but there are some things you can do to help make it easier. For example, holding the infant upright for 20 minutes right after feeding them. Sometimes spitting up can get better if you change the child's formula, if they're formula fed. But talk to your pediatrician before doing this because they might want to recommend a different formula. If you have any concerns that your child's spitting up is changing and becoming more like forceful vomiting, you can always call your doctor or bring your baby to the emergency department.